Hello, everyone. Good morning, and thank you for tuning in to the latest installment of the Active Transportation Resource Center's webinar series. My name is Marianne Hernandez. I'm part of the Active Transportation Resource Center team that's based in Sacramento at the California Department of Public Health. My colleague, Alicia Ramos, will be working behind the scenes to help run the webinar. So I appreciate her very much. As many of you are aware, the ATRC is a Caltrans-led statewide project funded through the Active Transportation Program. Our mission at the ATRC, which is the acronym, is to provide support to local agencies by providing relevant, timely active transportation-related resources, technical assistance, and training, and of which this webinar is a part of the training. I'll be facilitating our webinar today, and you will hear about the Healthy Places Index and the EpiCenter database and how we can use these tools to better understand our local community health needs. All right, let's go ahead and advance the slide here. But first, before we get started, and while people are getting online, we have a poll question about the Healthy Places Index, and that should pop up shortly. The first question is, how familiar are you with the Healthy Places Index tool? Very, somewhat, or not at all familiar. And the second question is, have you used the HPI before? If you have, if you wouldn't mind typing in the chat how you used it. So we'll leave this up for a few seconds, and you should see it up there on your screen. Alicia, you just go ahead, and when you feel like we have a good amount have answered, we're slowly, we have many more registrants that are online right now, but we'll go ahead and just get an idea of who's used the HPI in the past. Thank you very much. So it looks like, oh, good. It's good that we have some novices because you'll get to really get a sense for the HPI. As you can see, we have about half the people that are on right now have not used it at all. And about over half have not used it before in the past, or not familiar or not. So that's great. So we'll go ahead and close the poll and then move on to our next slide. Sorry about this, my little mouse thing. All right, so thank you so much. So that's a great, good to know that most of us, about half of us, haven't used the HPI, so you'll learn a lot today. Our objectives today are to learn how the Healthy Places Index tool can be used to establish your community as a disadvantaged community and highlight the health of your community. So it can do both. And the second presenter, Marisol, will tell us more about the EpiCenter tool, where you can identify how the death and hospitalizations for walkers and cyclists in your community. And a bit about our logistics. As people are presenting, as Helen and Marisol are presenting, you can type your questions in the Q&A, and then we're going to wait till both presenters have presented, and then we'll address your questions. But you can type them in the Q&A function at the bottom of your screen at any time. When you log off, you will have a survey will come up, an evaluation survey. So please take that. And just for your information, we will have the recording and the slides uploaded onto the Active Transportation Resource um, um, website under training. So you don't need to take notes. You can just listen intently. So as the title of our presentation mentions, the purpose of these two presentations is how we can use the HPI and the EpiCenter databases to strengthen our active transportation program application. We are now in the process of preparing and working on the Cycle 8 application, which will be released in March of 2026, and that it will be due by June. But there's lots of preparation that happens before. So Alicia will put in the chat where you can find out more about the different workshops regarding the Cycle 8 application. As for the EpiCenter and HPI, the HPI can be used in Part B, Question 1, designating your community and disadvantaged community. So it's one of the approved tools you can use to do that. And that's important because it's 10 points of your application. So you really want to make sure you use a tool to establish your community as disadvantaged to strengthen your application. And then there's also question 3 in Part B, which asks for the potential for reducing the number and or rate of pedestrian and bicycle fatalities and injuries in your region. So EpiCenter does exactly that, so that it's a good tool to be used for background and as well as this part of the application. And as an example, Helen will give you another example, but for Cycle 6 awarded applications, the HPI was the third most used tool to demonstrate disadvantaged community status. And a specific example from Cycle 4 is the San Juan Unified School District in Sacramento County used the HPI to show that there was less access to a vehicle and higher obesity and diabetes rates. So it was used to establish need in that part. So we have two presenters today. We have Helen Dowling and Marisol Pesquier. And our first speaker is Helen. And so Helen, I'm gonna talk a little bit about you and then I'll turn it over to you. Helen Dowling is the Director of Data Initiatives at the Public Health Alliance of Southern California. She is the project manager of the California Healthy Places Index, which you'll hear about today. The HPI is a data and policy platform created to advance health equity through accessible data. She has a background in sociology, information technology, and epidemiology, and is passionate about leveraging asset-based framing to uplift communities that have faced historical disinvestment. So I'll turn it over to you, Helen. Welcome.
Great, thank you so much. All right, I'm going to share my screen. Just a moment. So, hi folks, again, my name is Helen Dowling. I use she, her pronouns, and I'm the Director of Data Initiatives at the Public Health Alliance of Southern California. I also lead all of our data work at the Alliance, including our Healthy Places Index project. So, if you want to learn about the HPI, you've got the right person in the room. So, I encourage you, if you have any questions or comments about the HPI, as we go through today's presentation, please feel free to drop them in the chat and Q&A, and we can get to them at the end. I will also leave my contact information at the end of this presentation as well. So if there's something that pops up after today's conversation, you can feel free to reach out, because we always love to hear from folks and how they're using the HPI and how we can make the HPI better for your work. So let's get started. So today I'm going to talk about using the California Healthy Places Index for your ATP application. And just a little bit of background about what the Public Health Alliance of Southern California is. So technically, we are an active coalition of 11 local health departments in Southern California, and we are on a mission to mobilize the transformative power of local public health for enduring health equity. And our jurisdictions represent about 60% of the population in California. So we produce tools not just for Southern California, but also for the whole state. And the HPI is an example of one of those tools. Our work actually covers multiple different initiatives. So we have our Health Equity and Justice Initiative, our Climate and Health, and our Data Initiative, which is the initiative that I lead. You can learn more about the Alliance at our website, and it's at thepublichealthalliance.org. Again, I'll leave that information at the end of the presentation. I always like to start our conversations about the Healthy Places Index by queuing up our shared value. So this shared value is something that not only is held by the team members of the Alliance, this was really our grounding value as we developed the Healthy Places Index with our partners from local government, community-based organizations, and more. And that shared value is that everyone should have a fair and just opportunity to achieve good health and well-being. But it turns out, in order to get there, to get a healthy life, it's really all about where we live. So those community conditions, those conditions in a neighborhood, so things like access to good jobs, education, clean air and water, these are the things that actually really shape health. They make a big difference in it. And they don't only make a difference for things like chronic illness and disease, like diabetes, for example, but they also impact, how likely it is for you to get infectious diseases too. And we saw this in a pretty big way with COVID-19. So communities that had fewer health supportive community conditions actually were hit harder and had higher case rates and higher mortality from COVID-19. So where you live plays a huge role in what your health and well-being looks like. And we call these the social determinants of health. It was our goal to create a tool that allows us to actually quantify and measure those community conditions that shape health. So we created the Healthy Places Index. It's a peer-reviewed and published tool, so there's a paper you can dig into if you're interested. And not only do we quantify the impact of community conditions on population health, we also provide recommendations for policy action. It was important for us to not just show where the opportunities for improvement are, it was also important for us to give folks examples and ideas for how you can actually make improvements too. So we have the data and ways you can actually impact those indicators we measure in the HPI. Uniquely, we also have a positive and asset-based frame, and what that means I'll actually demonstrate when we get to the tool itself, which we're going to kind of do a live walkthrough. Our HPI is not just one thing. It actually has three different components. So we have our index, that's the data that kind of drives our tool. We have our policy action guide, so that's our linkage to action to improve the data. And we also have our interactive map, which really brings all of these components together. And all of these are designed to allow you to very easily access the data that you need to understand the community conditions, where you live and work. So let's start talking about each of these individual components. And I'm going to give just like a very high level overview here. We'll be sharing this slide deck as well as a link to an interactive version of this presentation. I want you to treat this actually as a reference, kind of a documented reference for your use later. You'll notice there are links and resources embedded in this presentation that you can come back to and revisit and kind of refresh your knowledge on later. So kind of keep that link handy and keep the slide deck handy. We'll be distributing it after the presentation. So first up is the index itself. So this is the data that drives HPI. It's a composite index, which comprises 23 different indicators. And these indicators were selected because they impact life expectancy at birth, which is a key health outcome, right? So things like infectious disease and chronic disease both impact how long people live. And so we wanted to make sure we were choosing that health outcome, life expectancy, that captures all of those health outcomes throughout the life cycle. In short, the healthier a community, the higher the HPI score. And we organize our indicators into what we call policy action areas. They're kind of themes. And you can see all of our indicators and our HPI policy action areas in the visualization here. So our indicators measuring community conditions go from economic, education, transportation, social, housing, healthcare access, clean environment, and neighborhood. And one thing I'll point out here, and this is kind of getting into the nitty gritty, I'm going to give you a peek under the hood of HPI, but you'll see that there's some numbers that are associated with each of these different policy action areas. That's actually how much these indicators influence the overall HPI score. Essentially, because our HPI score is designed to maximize the association with life expectancy at birth, indicators like employment, income, educational attainment in California have a greater impact on life expectancy than some of our other measures of community conditions. So these count more when we are calculating an HPI score for a community. But everything that you see here is linked to life expectancy. And if you were to improve any of these indicators in a community, we would expect to see improved health outcomes. The second piece is our policy action guides. And I'm not going to talk too much about these right now because I actually want to get you into the tool and using it to find neighborhoods for your applications. But I do want to share that these are a tremendous resource that even if you don't end up using the HPI for your work, I actually really encourage you to check out the policy action guides because they are framed around all of these different indicators, all of these different community conditions that you can improve to impact health. And you might be able to take a policy idea that comes from these policy guides and implement it as part of your ATP application or a program that you're designing or a project that you're designing. So even if you don't use the HPI, please check out our policy resources because they really make the clear case for how these community conditions shape health. And we give you lots of recommendations for how you can move the needle. So check those out. And then the last piece is our interactive map, which allows you to dive deep into our HPI data. We also have lots of other supplementary data on things like health outcomes, demographics, languages spoken, as well as lots of other features and functionality to work with and use the map. Pay special attention to this slide because I've linked all of our video tutorials. So if I'm going too fast or you have more questions about how to use a particular feature or function, come back to this slide. I've got links to all different kinds of very, very short, brief video tutorials that'll get you up and running pretty quickly. Okay, so Marianne already queued this up, right? How you can, in the ATP applications, you need to identify a disadvantaged community to be eligible. And the Healthy Places Index is an improved and approved tool for this purpose. So this is a little excerpt from the 2025 program guidelines. And it says here that you can use the HPI and that a census tract must be in the 25th percentile or less to qualify as a disadvantaged community. We're going to break that down and make that a little easier to understand. And I'm going to give you a couple of very easy, quick identifiers for when you hop into the HPI tool, how to find these communities. So let's talk about it. And again, this is another thing you might want to come back to, kind of reference material. How do you interpret an HPI score, or the HPI data that we show on the map? So we actually divide our HPI score into 4 quartiles. And what this means is that this is kind of allows us to quickly identify what the communities with the least healthy community conditions are and the communities with the most healthy community conditions. So communities that have a high score between the 75th and the 100th percentile, so those are the communities here in dark green, they've got the most healthy community conditions. And our communities down here in dark blue, so these are places that have an HPI score in the 0th to 25th percentile, have the least healthy community conditions. This is the piece you need to remember, and I also talk about it here in the little call out box. You want to look for those communities that are in dark blue. Those represent the bottom 25% of HPI score communities. These are the ones with the least healthy community conditions, and they are considered disadvantaged communities by the ATP guidelines and definitions. So you want to be looking for these dark blue communities on the map. These pieces I'm not going to go over in detail. Just know that I've got some detailed breakdowns on how to understand our HPI scores as well as our indicator values. So that's here for you to take a look at in the future. I recognize it's kind of tiny. You can't really see too much detail here right now. All right. So this is the fun part where we actually get to hop in and use the tool live. And this is really the piece that hopefully will bring all of these individual components together. So I'm going to go ahead and pop open my web browser, and I'm going to change the screen share. Just a moment. All right. So you should now be seeing the California HPI map, and this is what you'll see when you first load it. I mentioned a little earlier in my presentation that HPI uses this positive asset-based frame. Well, what does that mean? Well, it means that we're actually not focusing on disadvantaged communities. So while you need to identify disadvantaged communities for your application, we actually don't call them disadvantaged communities in our tool. And that was really intentional. There's also a reason why you don't see like reds or oranges or things like that to identify communities on our map, because we wanted to be really cognizant of the negative connotations of those colors. Essentially, we don't want to re-redline or stigmatize communities. It was more important for us to help communities identify the assets that are already exist in their communities, in every community, even ones that rank in the bottom quartile of HPI have assets. There are strengths in every community, and we wanted to make sure that it was going to be easy to find that information. And alongside that, every community has things they can improve upon too. There are opportunities for improvement. So our orientation with the Healthy Places Index, that's why we call it the Healthy Places Index too, is to really orient folks to strengths, assets, and opportunities. And this was a really key part of our communication and messaging strategy. It's also a lot easier to take this to your communities and engage them with these data when it's positively framed. Instead of saying, hey, here is this data that says you have a disadvantaged community. Let's talk about all of the ways that it's failing. We want to flip the script and really come at it at a more positive orientation. So that's what we did. And so that's why you see a map in blue and green, not in red and green. So if you recall from what I shared a couple of minutes ago, those communities that you see here on the map in dark blue, these are the ones that are ATP application eligible. So let's kind of dive in a little bit more, because not only does this tool allow you to find those eligible communities, so let's take a peek at Stockton here. I'm going to click on this community. You can get more detailed information to also help flesh out your application. So we kind of give a couple of quick pieces of information. So we tell you where it ranks. So this is in the bottom quartile. So it tells you right here, the 9.2 percentile, tells you where this community is located and its population. And then you can actually look at every single indicator that's here. So we can see in this community, our economic indicators are pretty low, right? So these likely represent some opportunities for improvement. But then we can look, for example, at some of our clean environment indicators, and we can see here, things like ozone and diesel PM are actually above the median, right? So these are some strengths that this community has. We try to make it easy for you to find both those strengths, as well as those opportunities for improvement. And as I said, this is a community that is pretty low ranked. It's below the 10th percentile. It means that about 90% of other communities in California have healthier community conditions, but there are still assets here. So low-income homeowners actually don't have, there's not very much in the way of severe housing cost burden. That's a good thing. Same thing with renters as well. But we can see measures like uncrowded housing that represents an opportunity for improvement. So it's not just the overall number, it's actually the context that all of those indicators give you. And I recommend, if you have the resources and the time and the opportunity to do this, you can use the HPI to really paint a more complete picture of the community and project area that you are putting in your ATP application. There's a wealth of information here that's worth exploring. I also want to share that while information on race and ethnicity does not influence the HPI score, race and ethnicity, or more accurately, racism, is actually a pretty strong and proven driver of health. So we think it's important for you to be able to see that data alongside our HPI score, which is why we provide this really detailed breakdown of the different kinds of communities that are here. This is actually a really diverse community, so we can see that we've got about 17% of people here identify as Asian alone. We see about 60% identify as Hispanic or Latino, 5% Black or African American. And for a lot of these categories, you can actually drill down and see that the Asian alone category is not a homogeneous group. We have Filipino, Cambodian, Pakistani, and knowing the types of communities that are located within your project area can help you decide if you need to provide materials in different languages, if you need to find key messengers to reach specific populations. This is really critical contextual information that I don't want you to overlook. So you can take a peek at that as well. One question I want to get ahead of is, what if your project area actually goes beyond a single community? Maybe you want to put in a bike lane, right? How do you get an HPI score for something that crosses multiple census tracts? Well, we actually have a tool for that. So if you go to our tools menu and you scroll down, I want to point out our pool geographies feature. So this allows you to connect multiple communities together, and our interactive map is going to automatically recalculate the HPI score and all of the indicators and data for your combined project area. So let's go ahead and do that now. And it's as easy as clicking the Pool Geographies tool and then just clicking on the map. So say I want to put a bike lane that's going to cross these 4 communities. So I've clicked them and you can see these are the tract identifiers here. I'm going to click Pool Tracts, and it's going to take a minute because it has to recalculate all of the different indicators as well as the HPI score. But once that's done, you'll be able to click on that combined project area, and you can take all of that indicator information. So you can see a recalculated value, not only for the HPI score, but for things like educational attainment or per capita income. And it's actually the average of all of those communities that you have decided to pool with this tool. You can also use this to get other contextual information like our health outcomes data, which I will show you in a moment, which is another piece of the puzzle here that you might want to explore. With the HPI interactive map, we like to think of it as a one-stop data shop. So you can access not only data on the HPI score and kind of those indicators that are measuring community conditions, but we have that race and ethnicity data. We have all kinds of supplementary data on things like health outcomes, other measures of community conditions that aren't included in the HPI score, as well as languages spoken. And I'll show you that in a moment because it means you don't have to go to a bunch of different websites. You can actually get it all through the HPI. So here is our combined project area. And if you click on it, then you're going to get, as I said, it's recalculated everything for this group of tracts. So we can see that these 4 tracts together, now they have a larger population. You can see an overall HPI score for them. And so you can do this if your project area is actually going to cut across multiple communities. So the last thing I wanted to show you was our decision support layers. So that's under view indicators. And these are these kind of the one-stop data shop that I was referring to. So if it's important for you to look at things like health outcomes or health risk behaviors, for example, maybe no physical activity measures, you can click this and the map will actually reload to show you this data instead of the HPI score. So it might take a minute. And I also wanted to demonstrate here that the pooled geography that we made, that grouping of communities, it's also going to calculate physical activity for that specific project area. So this really gives you, like, if you need additional context for your application, additional data points, you can go to our view indicators and our decision support layers. We have literally hundreds of additional data layers here, and you can get them not only for an individual community, but for a project area. So there's a lot to see and do here. I recognize I've gone through quite a bit in a very short amount of time, but I want to remind you that back on the slide deck, there are links to video tutorials that actually cover everything that I've just talked about. And I know we're going to be sharing this recording as well as other resources for using the HPI. So don't fear, you can come back to this. You are also, again, I just want to encourage folks to reach out. If you are having any challenges accessing the data or using the map, send us a note. We're happy to help walk you through it. So I'm going to switch back to my slide deck. And I want to wrap it up by sharing that not only has the HPI been used for ATP applications, it's used in all kinds of other contexts as well, including HPI was used to identify communities to get funding for community arts projects, which is a really exciting use case we saw, directing rental and housing assistance, climate resiliency assessments, informing recreation and park plans, all kinds of things. If you want to dive in more detail here, there's a link in this slide that goes to our HPI into action page that talks a bit more about these use cases. But I thought it might be great to actually see a use case of HPI specifically for an ATP grant. So a few years ago, our partners in Riverside actually used HPI as part of their application for a Safe Routes to School program. And I believe this was funded. They actually took the data from HPI directly and kind of revisualized it for their application. So you'll be in good company if you decide to use the HPI for your work. There are additional links and resources in this presentation here. I won't go through this in too much detail, but just know it's in the presentation. So many questions that you might have are likely to be answered here, and I'm also happy to answer any questions you have at the end. So here's my contact information. Feel free to note that down. Would love to hear from you.
Thank you so much, Helen. Yes, that's a very, very rich tool. And I love that you showed how you can still use HPI across census tools, because there are definitely people trying to improve routes and gaps in walking and biking routes. So thanks so much. I'd like to go ahead and introduce our next speaker, Marisol. While she's pulling up her slides, I'll tell you a bit about her. Marisol Pasquier is an injury prevention epidemiologist and data scientist with the California Department of Public Health Injury and Violence Prevention Branch. She has worked in injury prevention and surveillance at the state of California for over 6 years and is currently the lead epidemiologist for EpiCenter, California's injury data dashboard. Take it away, Marisol. Thank you.
All right, thanks, Marianne. So, hi everyone, my name is Marisol Pasquier. I use she, her pronouns, and like Marianne said, I am the lead epidemiologist for EpiCenter. I'm going to talk with you all briefly about what EpiCenter is and actually walk you through the EpiCenter user guide, which is available for you to access at any time on the EpiCenter site. And then you will also have have a copy of these slides when they get posted. So first, you may be wondering how EpiCenter differs from some of the data that you have used in the past in your applications. And the short answer is that EpiCenter data describes the outcomes of injuries. So the focus is first on what happened to the people rather than the circumstances. And then second, it's focusing very specifically on injury outcomes. So the dashboard presents data for injuries that resulted in an emergency department visit, a hospitalization, or a death. So for you all, you can use EpiCenter to view trends in pedestrian, bicycle, and traffic injuries at the state level or by your county. So let's hop in. So from the homepage of the site, and I have linked the site here on this slide, so you can use that link to access EpiCenter when you'd like. So from the homepage of the site, you're going to see a box on the left of the page with various links, including what we've called the user guide. And when you click on the user guide, you're going to see this page right here that we've highlighted with a list of expandable topics. And to start, we're going to go through this very top section called Getting Started. When you expand that Getting Started topic by clicking that header, you will see this guide, and it walks you through how to use all of the EpiCenter features to both view and download data. So like I said at the beginning, EpiCenter includes data for injury-related deaths, emergency department visits, and hospitalizations. So to get started, you're actually going to need to use the tabs at the top of the page that are highlighted, they're circled in red here, to select what type of data source or outcome you would like to explore. So for these examples, we're going to pick one, and we're going to be walking through deaths as an example. So once you have selected your outcome of interest, you're going to come to a page that looks like this. And then there are some key elements to note. So first, you can use the sidebar on the left to view and select available filters for the data. So you can filter using any of these, and these filters are marked 2A for your convenience. Filters are organized under some broad categories, and those are person, place, time, injury, and then for non-fatal injuries only, treatment. And you can click on each category to expand and view or hide the filters that that menu contains. Filters will be automatically and immediately applied, but you could there could be a delay while it implements that filter. A description of the current filters and the number of injuries that you have filtered by will appear at the top of the page underneath that blue panel that we have labeled 2B. And then to quickly clear all filters, since we know there is a lot of things you can do, and if you just need to reset, we have provided a Reset All Filters button that is labeled 2C at the bottom there. Okay, moving on to how to display data. So you can choose to display data using 3 outputs listed as tabs that's right under that description. And those are a custom table, a time series, or a bar chart. So if you select the tab at the top of the page that says Custom Table, EpiCenter is going to display a table of injury counts by selected variables. If, this is a note, and I'm going to actually show you an example of this in a bit. If you select a combination of groupings using those menus labeled, those drop-down menus labeled 3A, if you select a combination of groupings that results in less than 11 cases, you will actually see a blank row in the table because the data have been suppressed to follow our data de-identification guidelines. But let's hop back over to all of these highlighted items. So as you can see with 3A, the data can be grouped by up to 4 variables using drop-down menus above the table. Again, because we give you so many options to group the data, you can quickly click the Reset Group buttons marked 3B on the slide here to reset all groupings. You can also view rates for a lot of things. The table will display incident rates per 100,000 person years if you select the little checkbox marked 3C. Also, because you may want to take this data and visualize it on your own or use it in some other way, there is an option for you to download data. So once you've selected the combination of filters and groupings that you like, you can click that button labeled 3D to download the data as an Excel file. This is the quick note about selecting a combination of filters or groupings that results in less than 11 cases. So as you can see here, I have created a combination of variables that has resulted in less than 11 cases. So what happens is you see a blank row or rows in this case, depending on what you've selected. And this is not an error or anything. This is just EpiCenter correctly suppressing the data, as is shown here. Moving on to the next type of visualization you can do, which is the time series. You can also display injuries over time as a line graph. Again, we have some slightly different options here for grouping data by. So you could group data by 3 types. So you could first select a group. You can select an injury measure. This is going to be a rate or a count. You can change the time unit from years to months to weeks using that third drop-down menu. And a note here is that this graph is limited to displaying 10 or fewer groups. So if you select one of the group by options that has too many groups, it's actually going to give you an error saying that there are too many groups to graph. You can, if you do still want to see that as a graph, you would just have to adjust your filters to visualize the data. You can also hover over any point in the graph to see values for each data point, as we've highlighted with 4D. You can download whatever graph you've made as an image by hovering over the camera icon in the top right corner. And like with the table, you can download the graph source data as an Excel file. Lastly, if you select the tab at the top of the page that shows that says bar chart, this is going to display injuries for you by groups as a bar chart. So again, you can group the data by variables from the drop-down menu above the chart. This chart is limited to displaying 120 or fewer groups, just so you're aware. You can choose to display injury counts or incidence rates from the second drop-down menu. That's labeled 5B. And you can also change the bar order from grouping variable, by grouping variables. So you can order it by group. So in this case, this is grouped by groups, meaning it's grouped by age. But if what you really wanted to see was which in this group, which people in this group or which age categories in this group have the highest rates, you can actually select injury measure instead. It'll organize the graph by injury measure. Like with all other graphs on here, you can hover over the chart to see values for each bar. You can also download the image and download the data using the download buttons. Okay. I'm not going to go through this, but I did want to point you to this because we are going to hop over to a live demo. I did want to let you know, though, that that user guide we just walked through does include a suggested analyses section that provides some examples that you could look at when you're starting to look at data for your county. It provides some really interesting questions for you to think about, but let me hop on over really quick to EpiCenter. So this is EpiCenter. Hopefully that popped up for you. And I have already selected the hospitalizations tab here. So as we can see, this is what pops up when you first select EpiCenter and you start with an injury measure. So it's going to tell you the total number of injury hospitalizations discharged in 2023 among Californians aged 0 to 100 plus years. So now let's go through and apply some filters. So for this example, I actually want to filter by place, and I am going to filter, I actually want to look at injuries in Sacramento County hospitals. That's what I'm going to be interested in. So you can either type Sacramento or you can scroll to find what you want. So there we go. I have filtered the data by Sacramento County. This is all injury hospitalizations discharged in 2023 in Sacramento County hospitals. But that's not all we're interested in. I also want to look at some specific injuries. Since this is ATP, let's go ahead and look at pedestrian and pedal cyclist injuries. That's kind of how they're classified here. So I'm going to scroll down and we can see that we have pedal cyclist, pedestrian, these are the MVT, motor vehicle traffic, and then we also have other. I'm going to select all 4 of those. As you can see, while I was selecting those, it was updating. So now if we look, if you're curious about what you selected, the top of the page here always shows you what you have selected. So it is showing us 494 comprehensive case definition injury hospitalizations discharged in 2020 in Sacramento County hospitals with these 4 injury mechanisms. And we can see that there are 491. Now let's say we wanted to dive a little bit deeper into what these were. We can start selecting things on the table here to group the information by. So let's just say, okay, this tells us some interesting things, but I'd actually like to see how many each of these 4 injury mechanisms, how many injuries were for each of these types. So if we group by injury mechanism, we can see the breakout of pedal cyclist and pedestrian here. We can see that it goes MVT pedestrian, then pedal cyclist other, then MVT pedal cyclist, and lastly, pedestrian other. We can also look at injury intent if that's something you're curious about. So you would just flip it and put injury intent first and injury mechanism there. You can see that most of these are unintentional injuries. We do actually get a 1 assault. As you can see, it is less than 11 cases for this one. But I'm actually going to put this back to injury mechanism because I want to highlight something else that's really interesting about EpiCenter that allows you to, the EpiCenter allows you to visualize. So we have injury mechanism. This tells you something about what happened, but it doesn't tell you a good picture. So what you can do is you can scroll down here. If you're very familiar with ICD-10-CM, those are the injury classification codes used to code billing data. You can absolutely view it by ICD-10-CM code. But we know that not everyone has those codes memorized and they are very hard to track. So what we do have is this injury cause description. This is actually the text description of ICD-10-CM injury code. So if we select that, you're now going to get a lot more detail on what each of these injuries were, how they were described in the billing data. So as you can see, there are going to be a lot more rows that have less than 11. So you're not going to see counts for this, but you are going to get a good picture of what is going on here. So let's go ahead and sort this table by injury. And we can see here, these are the highest to lowest counts of injuries for these categories. So we get some great description here. We can tell that there's pedestrians on foot. We can tell that there are pedal cyclist driver and sort of what has happened per the ICD-10-CM codes. We can also see that while the counts are small, there are a lot of mentions of electric assisted bicycle injuries, quite a lot. Let's see. I want to make sure I am mindful of time. I actually think I'm going to pause here because I do want to allow us to have time to go through some questions, and I'm happy to revisit anything, but I do want to give us some time to go over questions. And I think I've covered some of the coolest aspects of EpiCenter.
Agreed. Thanks so much, Marisol, and thanks for letting us have some time for questions. If you, Marisol, if you'd put up your last slide so people know how to contact you, and keep in mind, everyone, all these slides and the recording will be posted, so you'll be able to refer to them later. We have lots of questions, and I do want to introduce our Caltrans colleagues, Ali Dewar-Westbrook and Michael Hutnick, who will be able to answer some of the questions that have come up. And one of the questions that I saw that ask if we're not a dark blue, if we don't show up in the HPI as dark blue, but we're light blue, can we still apply? You can always still apply even if you don't qualify as a DAC. So that question I wanted to answer right off the bat. So Alicia, I'll let you go ahead and read our first question or one of our questions, and then we can kind of take turns.
Sure. I will read a question from Colin Clark, who says, how does EpiCenter relate to CDHP CMOD data and CCRS?
Sure. So the short answer there, I'm going to take a peek at this answer, is they're similar root data sources, but they look at different things. So CMOD is crash medical outcomes data that we work with, and that basically classifies how severe, worthy, as it says, medical outcomes of a crash. And I do believe it joins hospitalization, it joins data with different data sources. EpiCenter focuses just on the administrative data, meaning just the emergency department visit data, just the hospitalization data, or just the death data.
Great, thank you.
I'm muted, sorry. I thought this question was interesting, that the HPI and its link of to life expectancy assumes that someone lives their whole life where they are born. For instance, if you're born in an area with a low score, but you end up moving to a place with a higher score, does your life expectancy increase? Not so much ATP related, but an interesting question. Go ahead, Helen.
Yeah, so I love this question. This is a great question. Thank you for asking this particular question. And I will tell you that, it's actually hard for us to answer that question with certainty. So the HPI is an ecological tool, right? So we're looking at population level data. We're not able to follow individuals longitudinally. But the source of our data is where people have died. So when we're calculating our life expectancy at birth estimates, we're using death data and the address of where people have died, and that's what informs our life expectancy at birth calculations. So while we can't say for a specific person, if they were to move from a community with fewer health supportive conditions to one with more healthy community conditions, that their life expectancy would increase on an individual level, but from a population health level, yes, we can say that if people are living in a place with better community conditions, we would expect to see improved life expectancy.
Thank you. Alicia, our next question.
Yeah, so Helen, you touched on this, I believe, a little bit when you went into the various health data that you can find on HPI. But the question is, we are not disadvantaged, but our application was missing health data because we just don't have it available in our area. Can this be a substitute for the health data we lost points on?
So good question, because I don't know exactly what area you are located in, but we have pretty good coverage across the entire state. And more importantly, we actually have health outcome data built into the tool. So Marianne, can I actually share my screen again just so I can pop open the health outcomes tab on our
course.
Website? Yeah, great. Okay. So that way you can just see where they are available. So these are available under our View Indicators tool. So under Tools, View Indicators. And under that, there is this section, sorry, there's quite a bit here. Ignore the scroll, okay. Decision support. And then we have health outcomes. And so these are all of the different health outcome data that we have. So a lot of these are chronic conditions, we have disability data, we have pedestrian injuries as well. And most of these are available at the neighborhood and community level across the entire state. So I would take a look and see if you could find some data here that might help support your application. Similarly, since I'm sharing the screen now, I might also answer the question about using the maps for showing need for transportation improvements. Under our community conditions decision support layer, we actually have quite a bit of indicators that cover things like active commuting, so transit or walking. We also have measures like, let's see here, traffic impacts, transit access as well. So there's some other things that are worth digging into here. Again, even if you don't even use the HPI data, take a look at our View Indicators because there's lots of other data you can use to supplement your application.
And then I will, thanks for answering that question. So I will skip on to, someone asked about EpiCenter. You have to use it for your cycle 8. Not at all. We're just presenting another health tool. EpiCenter was just launched late last year. So we just want you all to be aware of it. But I will ask this question of our Caltrans team and our panelists. Is EpiCenter intended to replace the UC Berkeley SafeTrack TIMS ATP tool that is currently referenced in the ATP application? Hi, Allie.
Hi, good morning. Thanks for that question. No, we have not had a discussion about the EpiCenter replacing any tools that are currently listed within the guidelines. So yeah, at this time there's been no direction to do that. But in partnership with M.P.H, we'll continue to see what tools make the most sense for the active transportation program as we're updating the guidelines. And I think it was mentioned earlier, but cycle 8 guidelines conversations are happening now. So it's really a good time to plug into those workshops if you're interested in applying for the next cycle. And I'll drop a link in the chat for our newsletter. We oftentimes share out when those workshops are taking place, as well as the commission. They have a ATP listserv as well, and I'll drop their link or their email in the chat if you'd like to subscribe to their newsletter. Thanks.
And we're running very close to the end of our time here. And so, Rachel, I saw your question. And so we can forward your question to the speaker or answer the question ourselves and send you the responses for those that haven't been answered yet. But I'd like to go ahead and close us out. I'm sharing my screen again. Thank you. Let's see. So here you can see we support the ATP by Alicia and I assigned to different districts, and we support NI projects. So here on this slide, you can see our particular districts. So especially regarding NI. So if you have questions about your NI project or these presentations, here you have our contact information. Again, we wholeheartedly and from the bottom of my heart thank our presenters Helen and Marisol. And we realized that was a lot of data information, but both of those tools have extensive instructions. And thank you both, Helen and Marisol, for presenting. And keep in mind that all this presentation, as well as the slides with links embedded in them, will be sent out to you for reference. So again, thank you all very much. And once you log off, please fill out the evaluation.